The first thing you notice is the light. Not gentle light. 5 circular surgical lamps directly above you, so bright they have no edges. You don't remember the count backwards from 10. You don't remember falling asleep. You are simply here, and somewhere below your chest, something is happening to your body. You can hear them. Someone asks for suction. Someone laughs quietly at something you didn't catch. You try to say, wait. Your mouth doesn't move. You try to lift your hand, the universal signal, the one every human being reaches for when something is wrong, and your hand does not exist. The command leaves your brain and vanishes. You are awake, and you are the only person in this room who knows it. To understand what's happening to you, you have to understand what was put into you, because it wasn't one drug. It was 3. The first was meant to take your consciousness. The second, your pain. The third, your movement. 3 separate jobs, 3 separate chemicals, and here is the detail that decides your night. They don't fail together. They can fail one at a time. Somewhere in the last few minutes, the first one, the one holding your mind under, thinned out. Maybe your body burned through it faster than the math predicted. Maybe your blood pressure was too fragile for a heavier dose. The other 2 are still working perfectly. So you try harder, everyone does. You try to open your eyes, the muscles that lift eyelids are muscles too. You try to turn your head. You try to make a sound, any sound, and discover that even breathing isn't yours anymore. A machine is doing that for you, at its own patient rhythm, indifferent to your panic. The drug doing this belongs to a family called neuromuscular blockers, and it works in the gap where your nerve meets your muscle. Your brain is screaming perfectly well. The message simply never arrives. And here is the cruelty of it. That drug does nothing to your mind. It doesn't calm you. It doesn't dull anything. It removes only your ability to be noticed. Every signal a human being has ever used to say something is wrong, the flinch, the shout, the squeeze of a hand, runs through muscles you no longer own. Lying there, you'd assume you are the unluckiest person alive. You're not, and the real numbers are stranger than you'd want them to be. If you count only the people who wake up afterward and tell someone, the approach of a landmark study covering roughly 3 million operations, this happens to about 1 patient in 19,000. Rare. Comforting, even. But when researchers stop waiting to be told and start asking, carefully, repeatedly, in the days after surgery, the number climbs to somewhere between 1 and 2 in every 1,000. Same operating rooms, same drugs. The difference is only whether anyone thought to ask. Which leaves a question hanging over every hospital in the world. If the number changes that much depending on how hard you look, how many people has this happened to who never knew? There is a way to find out, and it is one of the most quietly brilliant experiments in medicine. Before the paralytic goes in, they inflate a blood pressure cuff around the upper arm tight. The drug travels the bloodstream, reaches the cuff, and stops. Everything above it goes still. Everything below stays connected. One forearm keeps its line to the brain. Then, in the middle of surgery, the anesthesiologist leans over and asks the patient to squeeze their hand. And sometimes, the hand squeezes back. Sit with that. Somewhere in the world, right now, there are patients under general anesthesia responding to instructions. Most report no pain. Most remember nothing at all afterward, which means consciousness is not the simple on-off switch we imagine. You can be present without suffering. You can be there without keeping it. The lights are still above you. Your hand is still not yours, and nobody in this room has thought to ask you anything. If you're going to be here, you should know what here is like, because it isn't what films show you. Sound comes first. Hearing is the last sense anesthesia takes, and among the first it returns, which is why almost everyone who lives this describes the same thing: voices before understanding. The room arrives before the situation does. Then pressure. Not the blade-sharp agony you're bracing for, the pain drug is usually still doing its job. What reaches you is stranger. A deep, distant tugging, like something important being rearranged in a room you're not allowed into. And then the part that outlasts the surgery. It isn't the pain that follows people out of that room. It's the helplessness, the memory of trying with everything you have to be noticed and failing. Studies of patients who live through this find that a significant share carry lasting psychological injury, symptoms in line with post-traumatic stress. Many were never warned this was possible, so when they tried to explain it afterward, they assumed no one would believe them. Some were right. Now meet the one person in that room whose entire job is making sure this doesn't happen to you. They are sitting just above your head, out of your sightline, reading numbers, and they are walking a line thinner than you'd like to know. Because the operations where this is most likely are exactly the ones where going deeper could kill you. An emergency cesarean, where more anesthetic reaches the baby. Major trauma, where a patient already losing blood may not survive a full dose. Open heart surgery, for the same reason. In each case, the honest calculation is not how do I guarantee unconsciousness, it's asterisk how do I keep them under without stopping their heart. And some bodies simply burn through these drugs faster. Heavy drinkers, people on long-term medications that rev the liver's clearance, which is why, before surgery, someone asks you questions that feel too personal and slightly like judgment. That wasn't small talk, that was your dose. So why not simply watch the brain? Put a sensor on the forehead, read the electrical activity, and see whether anyone's home. They do, it helps. In high-risk cases, it's standard. But it is not a guarantee, and the reason should stop you cold. We cannot fully explain how general anesthesia works. We know the drugs, we know the receptors they bind. We have used them safely on billions of human beings. But the actual event, how a molecule dissolves your subjective experience, holds it dissolved for 4 hours, then hands it back with your memories and your personality and your sense of being you intact, remains genuinely unsolved. Which means the monitor above your head isn't measuring your consciousness. It's measuring a pattern that usually travels with it, and a pattern can lie. Every day, all over the world, we switch off human awareness with extraordinary reliability, using a mechanism we do not understand. Here is what you can't see from the table. The machine breathing for you is also measuring the anesthetic in the air leaving your lungs, telling the room how much is actually in you asterisk, not how much someone intended. If delivery drops, an alarm sounds, not a gentle chime, an alarm. That single measurement is one of the reasons this is far rarer than it was a generation ago. High-risk patients are now flagged before the first cut. Techniques change in advance. The tightrope got a net. And something less technical changed too. Awareness used to be waved away, bad dream, confusion, imagination. Today it's a named complication with reporting systems and a required response, including psychological support afterward. Which turns out to matter enormously, because being believed is most of the difference between a bad memory and a lasting one. So somewhere in your minute of silent panic, a number on that machine drifts. The alarm finds it. A hand adjusts a dial. And the light starts to soften. So, what happens if you wake up during surgery? Almost always this, a few seconds at the very beginning or the very end when the drugs are shifting anyway. A fragment of a voice, a vague sense of pressure, something you may not even file as a memory. Most people this happens to walk out never knowing it did. The version you just lived through, awake, aware, paralyzed, unable to signal is rare. Somewhere between 1 in 1,000 and 1 in 19,000, and rarer still for a routine operation on a healthy body. An entire specialty exists to keep you out of it, and it is very, very good at its job. Then the ceiling brightens and blurs, and someone says your name from a long way off. Your fingers move, actually move, and the panic drains out of you so fast it leaves you shaking. You made it, almost everyone does. But you'll never look at count backwards from 10 the same way again. Because here's what stays with you, long after the room and the light and the fear. For 4 hours you were gone, not asleep, gone. And then you came back, complete, carrying everything that makes you yourself. So where were asterisk you during those 4 hours? That's the next odyssey.